Hello and welcome to Health Professional Radio. Thank you so much for joining us today. I'm your host, Neal Howard, and we're in studio with Mindy Bolton, creativity coach and dementia care practitioner. She's here in the studio with us to talk about her role as a dementia care practitioner who utilizes creative thinking in order to engage those who are living with dementia and possibly Alzheimer's. Good afternoon, Mindy.
Hello. Thank you for having me.
Thank you so much for coming back and talking with us today. As a dementia care practitioner, in another segment, you said that you were studying art when the world of caregiving was thrust upon you, and you found not only a new skill, a new passion, but also you found a need for people to learn the things that you had learned. When someone is suffering from dementia, does the dementia diminish creativity or simply make it just a bit harder to pinpoint?
So for the person who's living with dementia, I would say that creativity in the sense of, in its raw form, in creating something new. So, say, for example, a story, a work of art, an idea. I would say that is a skill that is retained when somebody has dementia. So therefore, they still have that skill. And I would say that, of course, in the case that they're still verbal, in the beginning and middle stages, they're living a life. A lot of times when we think of, say, a patient or a person, quote, suffering from dementia, we think that is, we look at it as a standpoint as dementia being the main thing in their life, when really, a person that's experiencing it, it's a day-to-day journey. Some don't know they have it yet. There's tons of research now explaining that the basically situations in the brain that start the process of dementia, the brain change, can begin before actual behavioral symptoms show themselves.
What types of changes are we talking about in the brain, and are there tests that can see these changes manifesting before the onset of symptoms, or are the symptoms the main thing that tip us off to the brain changing?
Well, right now I'd say socially, at least from the area I'm in the United States, it's still somewhat of a social stigma, and it's uncharted terrain for many doctors, especially those who are not geriatricians. So usually they do show themselves in the form of symptoms. Basically, people react to that person's display of symptoms. So my father keep forgetting this particular thing, or it seems to me that he is forgetting to eat, things like that. And then it is quite expensive to do brain scans for the average person. So that's not something, it's not everyone can go in and look at the brain. And I do, if anyone's curious to learn more about dementia and Alzheimer's, I would direct them to the Alzheimer's Association website. Because I always tell people, I'm not a doctor, but I know what I see, and I know what I hear from reports when I'm working with the caregivers, when they're displaying these symptoms and living out their daily lives. So neuroscientists know a ton more about what's actually going on, and then I would per se know more about what I see. So what you tend to see is the person's life slowly changing. And if they had a job that, for example, they were an attorney and they had to keep track of a lot of information and do a lot of critical thinking and have logical, linear plans for the day, that is what starts to slip away. And that is what starts to become difficult. I think when we're all under stress, we can relate to that. I mean, there are things that we do to ourselves that inhibit our thinking. The brain is a very dynamic thing. So essentially, the creativity piece is actually what can stick with somebody when they're losing those other skills. So, for example, some of the most creative people I've known have been those who have dementia. So when I used to work at a nursing home, and I interacted with hundreds of residents every day, and a lot of them had dementia. And their social skills are still very much intact in the beginning phases. They can have conversations. They can comment on things. So, I might approach them in a way and they could have the most creative response that I would never have thought of. But it's because they're reacting to their environment as they now know it. And some of their left brain logical linear skills are leaving their minds. But if they feel comfortable enough, they can still engage with the world creatively. A good parallel to talk about, but to not emphasize too much, is children. and older people. And when the brain is essentially slowly shrinking, like what happens with Alzheimer's, it is sort of like a backward childhood development, which has been given a term retrogenesis. So your brain is changing, and you are now utilizing more creative and I guess emotion-based skills. Also skills like reading the expressions on people's faces. That's why theater is so important, because I find that if I exaggerate my expression, they're more likely to respond to it in a more human-to-human way. So if I laugh really hard, they're going to start to smile, you know.
I'd like to ask a question that has to do with these techniques. Are
Right.
these techniques that can be used to coach creativity in anyone, or have they been tweaked in order to specifically target those suffering from dementia and Alzheimer's? Or, am I saying is just simply something where you just do a little bit more intensely with someone that has
Right.
Alzheimer's? What is the big difference between creativity coaching in, say, a classroom setting with, as you say, children, and creativity coaching with someone who's an adult? They've lived their life, they've known a lot of things, but now they have dementia.
Right. This is a beautiful question, because it also emphasizes the endless, vast opportunity in this whole concept. Because when you have community members, they're of different ages, different colors, different everything. It's diverse. And so it's good to find models that can address everyone. So I would say I use the same general models that I do with those who have dementia when I do groups for people who work with people who have dementia, even though they do not themselves have dementia. And I do things that allow people to be creative and expressive. And, it's almost harder to engage the people who are, quote, of sound mind because they have a lot of inhibitions. But these techniques can be used in any way. And I would say there are subtle variations between each one that are easily teachable. And that's kind of part of the process I'm going through, is articulating that.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio with Mindy Bolton, creativity coach and dementia care practitioner. It's been great having you here with us today, Mindy.
Thank you.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to this podcast on iTunes.